Lloyd Old was a person that I had a very special relationship with. One of the things that I learned from Lloyd Old was it broadened my outlook that what was going on with Laetrile was only part of a broader picture of the whole question of these unconventional treatments. And the method that was really his focus and the focus of a number of other people at Sloan-Kettering wasn't Laetrile, it was Coley's toxins. The Coley's toxins were a kind of fever therapy that had been invented in the 1890s and had been brought by William B. Coley into Memorial Sloan-Kettering, where he was a famous bone surgeon. Coley was treating the girlfriend of John D. Rockefeller, Jr., and he did all the proper things. The woman had cancer of the arm, and he amputated the arm and figured, well, terrible tragedy, but at least she'll be safe now. And lo and behold, the woman had a recurrence of her cancer, and she died. And this had a tremendous effect on Coley, as it did on the Rockefeller family. This was probably the origin of the Rockefellers' long 4-generation involvement and history in philanthropically funding the cancer research field. But for Coley, it made him think, I wonder if anybody with this kind of cancer ever was cured. And so he went back to the records at New York Hospital, and he scoured those records to see if anybody with that kind of cancer had ever been cured. And lo and behold, he found a record of a man, a German refugee, who had the exact same kind of cancer and had left the hospital supposedly free of cancer. What had happened is that the man had contracted an infection in the hospital of a disease called erysipelas. Erysipelas is caused by a strep infection. And so this shows you the difference between Coley and a million other doctors who would have encountered similar records. Coley went out there and traipsed up and down in the tenements of the east side of New York to finally, in kind of Sherlock Holmes fashion, found the guy and brought him back to the hospital, and lo and behold, the man was free of cancer 7 years after the time that he had this spontaneous remission that was triggered by this infection. So based on that, Coley started to give the infection to patients. From the New York Times, July 29, 1908. Erysipelas germs as cure for cancer. Dr. Coley's remedy of mixed toxins makes one disease cast out the other. He had a lot of success, and then went on doing that until 1936 or so, when he passed away. This was in the records of Memorial Hospital. His daughter, Helen Coley Nautz, had meticulously assembled all the cases that Coley had treated and all the cases other people had treated with Coley's toxins, and analyzed these up one side and down the other. There's like 16 monographs. She analyzed 896 patients with various types of tumors. So when we look at the survival statistics, some of these numbers just jump off the page at you. For instance, in what they call lymphosarcoma, which is now called non-Hodgkin's lymphoma, 49% 5-year survival. In Hodgkin's disease, 67%, 10 out of 15 cases. In sarcomas, as a rule, other than the lymphosarcoma, 78 of the inoperable patients out of 138, or 57%, were still alive at 5 years. In breast and ovarian and cervical, in the inoperable cases, the 5-year survival rate was between 65 and 67%. 2/3 of the inoperable patients with those kinds of cancer were still alive at 5 years, and the vast majority of these cases never received radiation. I mean, chemo wasn't really invented at the time Coley was working. So I got through Lloyd Old, I got to meet Helen Coley Nautz. She had a small coterie of people who agreed with her and believed her at Sloan-Kettering, and so they had a very tight partnership. She was an enormous influence on him. That was the seedbed. This shaped a lot of people. The Coley thing was really behind the Laetrile thing. And the fact that Coley was now acknowledged as the grandfather of cancer immunotherapy, which is now an accepted form of cancer treatment, that was enormously important, formative really, in the whole Laetrile thing, which was in a way a sideshow to the Coley story, which runs like a subterranean river through the whole history of Memorial Sloan-Kettering. What people don't know is that 100 years ago, in fact, even more, 150 years ago, it already was a common observation that if a person got a strep infection, they could be cured of their cancer, even a stage 4 cancer. Bush was a famous doctor in Bonn, Germany, saw the exact same thing. But it was Coley's brilliance that he actually went ahead and infected people in order to try to cure them. What you were doing was tricking the immune system into thinking it had a big infection, massive infection, septicemia, with dead bacterial byproducts, and then you'd get this sort of what we sometimes call a cytokine storm, where the immune system would be tremendously riled up. The person would get high fevers, the shakes. It took between 4 months and 6 months, and about half of them, had major effects, and they were getting terrific results. The problem was that it never was proven through a large, rigorous, randomized trial. So that was the main stumbling block. And behind that was the fact that you were talking about a microbe that's present all over the world, readily available, and you could brew tons of this stuff for next to nothing. I mean, basically the cost was the cost of hiring the lab technician to oversee the production. Coley had a colleague at Cornell named Tracy who made it up for him. But I think, what might at first sight appear to be an economic incentive, namely it's cheap and freely and readily available, turns out in a market economy to be highly undesirable because you virtually can't patent it. And even if you tried, the next person would come up with a slightly different version of the strep, and there's virtually no manufacturing cost. So we're seeing a little bit of the same thing happening around, the common generic chemo drugs. Nobody's particularly interested in them because there's not much money to be made from them. And it's the same thing with antibiotics. The government has to sort of beat the bushes to find somebody to produce antibiotics because there's no profit in them. Take a drug like Avastin, Genentech and Roche made over $6 billion last year off of Avastin, patented drug, with strong patent, with an army of lawyers to defend the patent. That's the perfect drug. It doesn't work, but other than that, it's the perfect drug. Ironically, Sugiura knew Coley for 20 years. When I interviewed Sugiura the first time, he brought up the case of Coley. He was the first one to tell me about Coley and about the parallels between the Laetrile situation and Coley. He was also the first one to suggest to me that some of the opposition to this sort of treatment was because of monetary concerns on the part of people who didn't like to see their lucrative incomes messed with. Coley's toxins, as well as hyperthermia and one other treatment, were taken off the quack list by the American Cancer Society. So I was there sort of at the relaunching of hyperthermia and Coley's toxins. It was about the official recognition that Coley's toxins and hyperthermia and one other treatment were really not quackery at all. They were just early stages of good science.
I suddenly realized I have to get a job fast because he was blacklisted from his field and he wasn't going to be able to work in that field for a long time.
I never applied again for another job in public relations because I knew very well that nobody's going to hire me in that field. And I decided to be a freelance writer in the medical field and specifically to write a book about my experiences and about the industry, as a whole, and that was what was first called cancer syndrome and then became the cancer industry. Eventually, the topic was taken up by 60 Minutes, of course, I wanted to do a whole full-scale interview with 60 Minutes, and I was hoping for this. And of course, the book was fresh out. It was in all the bookstores. I had a whole kind of whirlwind publicity campaign around it, and this was going to sort of cap the whole thing. So I did a whole, like an hour-long interview with Harry Reasoner, and it was wonderful. And then American Cancer Society went to work. And they managed to get this whittled down and whittled down and whittled down. And then they got to Bill Paley, who's the president of CBS, whose wife had been treated at Memorial. And basically, they said, we're cutting the whole piece. And they argued, the people at 60 Minutes argued with him. And the interesting answer came back: you can do the piece, but no Morse. And then they argued some more, and they said, okay, you can have Morse, but no Laetrile. We had quite a running cat and mouse game going between me and American Cancer Society. First, one of the vice presidents of American Cancer Society invited me to have lunch with him right when the book came out. I was just curious, what the heck is this about, American Cancer Society? And he said to me, he says, your book is actually costing us money, and donations are down on account of this, and it's just hurting us. So I'd like to propose that you come to work, you work for us. In other words, we've got endless amounts of freelance writing that we need done, and we can throw a lot of work your way. Instead of making a joke, I said, are you kidding? I said, it would take hundreds and hundreds of dollars to buy me. And he didn't know I was joking. He was ready to get out the checkbook. It was kind of a Woody Allen joke, but it didn't go over because he didn't know it was a joke. He thought, oh, that's pretty reasonable. Little things happened that showed me where things really lay. Like, for instance, back in about 76, I think it was, I was approached by a science writer, and we went to have lunch at a local restaurant on First Avenue. And we were having a discussion, and I probably, in typical fashion, I probably got a little bit too heated. I was talking too loudly from the point of view of discretion. And all of a sudden, a guy staggers over to my table from the next table over in this Italian restaurant, without any introduction of who he is or knowing who I was. He starts berating me, and he sounded from his voice to be quite potted. And he starts saying, you people at Sloan-Kettering, what the hell is wrong with you? Why don't you get with the program? What do you think you're doing? And all this. And I said, excuse me, who are you? And he pulled out a card, Deputy Director, Food and Drug Administration, New York City Division. And here I had made the indiscretion of talking openly, as I say, a little bit too loudly for, about Laetrile.
In Washington, the National Cancer Institute said today it will not make special tests of the effectiveness of Laetrile as a cancer medicine for humans, but will rely instead on case histories of patients who have already tried Laetrile.
At great expense and great difficulty, the NCI had polled all the doctors in America to give them cases that they felt had benefited from Laetrile. And I think it demonstrated the fact that sometimes, not many cases were in that series, but they were able to assemble cases where people did have remissions of cancer following Laetrile treatment. Laetrile passed the best case series. And then it was after that that the NCI agreed to do the clinical trial.
For 15 years, the federal government's National Cancer Institute has refused to test Laetrile on humans because it thought as a cancer treatment was useless. But the controversy has continued, and today the Cancer Institute says it will test it to see once and for all if it is any good.
Human trials were discussed from the very beginning. I mean, that was part of the reason that Lloyd Old and Stock and Good and so forth went down to Washington in '74 and in '75. What really happened is that the powers that be, the NIH primarily, didn't want those trials to take place at Sloan-Kettering because they didn't, quote unquote, trust Lloyd Old to be involved, and Good to be involved in running those trials. There was too much of a risk that the trials would turn out positive. Everything I saw was they were not against having a clinical trial done, but they wanted it done under the right supervision. And the person they got to do that trial was Charles Mortel. Charles Mortel was probably the greatest enemy of alternative cancer treatment and the greatest proponent of chemotherapy in the country at the time. So this one man had, a very destructive influence because he was sort of the quackbuster's quackbuster.
It is the first government-controlled human test of Laetrile as a treatment for cancer, an effort to settle decades of controversy.
The human tests of Laetrile or amygdalin confirm the results of animal tests from the study involving 178 cancer patients. The National Cancer Institute concludes Laetrile shows no benefit as a cancer cure or treatment. It does not extend the lives of cancer victims. It is, in a word, ineffective. Even so, the chief scientist in the government study conceded the results won't convince everyone.
We're not going to stop people from chasing rainbows, but I hope those who have been confused, who have been in doubt about this issue, might be dissuaded from going this particular route.
They tested Laetrile in patients with very advanced cancer who had prior chemotherapy. There were a lot of objections to that at the time. You're going to take this agent, which we now know, at least in animals, had no effect on large tumors, only small tumors, 1 centimeter or smaller, and lung metastases, and you're going to put that into patients with advanced stage 4 cancers whom had already failed chemotherapy. I mean, honestly, is that the system you'd expect it to fail in or expect it to succeed in? In the hands of a man whose entire professional reputation rested on a negative outcome of the trial, and then declaring once and for all, okay, it doesn't work, everybody go home, and that's the end of the story. I mean, imagine now the opposite scenario. You put the trial into the hands of an outright proponent of Laetrile. Who's going to believe it? Yet we were supposed to believe a trial that was in the hands of a person who, by his own admission, was a sworn enemy of the very concept of alternative medicine. It totally lacked credibility, and it was just really rammed down the throat of the Laetrilists. It was a proof of the greater power that the cancer establishment had vis-a-vis the Laetrile movement. The whole question had degenerated into a political power struggle between these two groups.
The government undertook the study not because scientists thought the drug was worthwhile, but because of political pressure from the advocates of Laetrile.
And truth was the victim.
That is the conclusion of the first government-approved study of Laetrile, published today in the New England Journal of Medicine. Cancer experts who conducted the research said their results were so conclusive that any future studies of Laetrile would be totally unjustified.
It was set up to fail in the clinical trial. You notice it was very conspicuously obvious that it was a phase 2 trial. In other words, there was no randomization. It would have been interesting, for instance, the conclusions would have been quite different had they given chemotherapy to those patients, if they had randomized the patients. Because my guess is, given the state of chemotherapy in 1982, for most of the cancers that they were looking at, and there was a mixture of all different kinds of cancers, chemo wouldn't have worked, and it would have been basically equal. So the conclusion would have been probably Laetril's no worse and no better than chemotherapy. But they didn't do that, and they kind of protected their own interests. Mortel was the person who introduced chemotherapy into the treatment of stage 3 colon cancer. And that was what he was famous for. So, but interesting if he had compared the effect of chemotherapy with the effect of Laetrile. Quite shocking to the public, I think, if Laetrile had come out the same as chemo or better. That would have led to a different conclusion and a different outcome, because then the public would have said, so Laetrile's no worse than chemotherapy, but your hair doesn't fall out and you don't get nauseous and you don't do these things. I guess I'm going to take that Laetrile. But by testing Laetrile alone, phase 2 trial, not a truly rigorous phase 3 trial, no basis of comparison, Laetrile looked pretty bad. And all the onus fell on Laetrile, and none of the onus fell on chemotherapy. So it was, they think these are smart people. I mean, my respect for their raw IQ intelligence has not diminished over the years. But a lot of the intelligence goes into being able to foresee how things are going to play out in the public arena. And it was brilliant. I mean, absolutely brilliant. The Laetrile trial, headquartered with Mortel at Mayo Clinic, was basically the death knell for Laetrile. Linus Pauling, by some estimations, was the greatest scientist, certainly the greatest chemist of the 20th century. He's also the only person in history ever to win 2 solo Nobel Prizes. One, of course, for his work in chemistry and the other for peace. And so he had a unique status intellectually in our intellectual life of the 20th century. He also was an amazing personality. And so, in a way, when he advocated vitamin C, it was a real threat, because he was a public figure who was incredibly compelling, especially in person, but also over the media. So there was a great resentment of him. And the person they got to do that trial was Charles Mortel. He became the main antagonist of Linus Pauling in the vitamin C study, and it came up with a similarly negative conclusion about vitamin C. The problem was that when Pauling and Cameron did their studies on vitamin C, they gave a combination of intravenous vitamin C and orally administered vitamin C. I believe that in the clinical trial on vitamin C, they gave either entirely or preponderantly the oral vitamin C. You can only take so much vitamin C orally and have an effect. The buildup of vitamin C at the site of the tumor, we now know, is 50 times greater when you give it intravenously than when you give it by mouth. Completely inadequate as a test of the effectiveness of vitamin C, and done in a really, I can only say, malicious fashion, in order to disprove a popular thesis. I knew Pauling, and Pauling had given me a wonderful jacket quote for my book. And when the test occurred, I spoke to Pauling on the telephone, and he said to me something that that still rings in my ears, that I will never forget. He said, I've never said this before about another scientist, but I really believe that there was fraud involved in this trial. And for somebody, the collegial relationships between professors in major institutions is almost the most valuable thing you have as a professional. You don't run down people to that degree, even when you disagree with them. So for Pauling to come out and say, I think Mortel defrauded the public, I think Mortel was involved in a fraud on the public with this vitamin C trial, was a very difficult conclusion for Pauling to reach. It was similar to what I saw with Sugiura when he finally realized that it didn't matter what results he came up with, that they were going to negate it until they came up with the negative result.
The recent controversy over Laetrile, a substance which some believe fights cancer, has now taken a new twist. A police raid on a suspected manufacturer in Manitowoc, Wisconsin.
Ray Howard to Marshall, I have a warrant for seizure.
It was the first raid of a Laetrile factory in the United States, and the FDA made certain the moment wasn't missed. Under orders from FDA Commissioner Kennedy, news organizations were notified 3 days in advance. The company, Mosinee Research Corporation, has been making Laetrile, what it calls amygdalin or vitamin B17, for a year, making it from apricot kernels shipped into Wisconsin. That in itself a violation of federal law, according to the FDA.
The government said that it was like the brown heroin traffic, so they tried to redefine Laetrile like it was an illicit drug.
Potential manufacturers are stymied by the FDA's continued ban on importation of the basic ingredient of Laetrile, the apricot pit.
It was kind of like, we'll tell you what's good for you and you just follow, and if you won't follow, then we'll legislate in a way that prevents you from being able to get the treatment that you want. Up until that point, very few people had questioned the safety of Laetrile. I mean, 70,000 people were taking Laetrile in 1977. There were very few major incidences of toxicity. The line was, it didn't do any good, but it didn't do any harm. Then there was this big push to turn that around and convince the public that it was dangerous.
In an unusual move, the Food and Drug Administration has issued posters warning that Laetrile is worthless and dangerous. The posters are going to federal and state agencies as well as pharmacies.
The government wants to ban Laetrile, but that ban is still being fought in the courts. Meantime, patients flock to pharmacies like this one here in Baltimore. Here they can obtain Laetrile, providing they have a signed affidavit from their doctor. The FDA wants to cut down on sales of Laetrile. This is the first time it's issued a warning poster in more than a decade. It says Laetrile is worthless as a cancer cure, it's dangerous, and it can even be fatal.
The Laetrile warning poster that went up into 44,000 post offices across the country. They made a statement on that poster that 17 deaths were attributable to the ingestion of Laetrile or Laetrile-like ingredients. I've gone back and I've looked at the 17 deaths. So they actually span a period of 150 years. Half of them, at least, were not really documented. We don't know who the people were, where they were, exactly what they did. Only one death was at that point was attributed to Laetrile. But everything got thrown into the pot. Whatever they could find that they could attribute to people eating plants with these cyanide-containing components got added in. And the one case of poisoning became the 17 cases. And yet, of course, this is how the battle of public opinion is waged, you know. The government has a few tricks up their sleeve. This was like only I think the third time in history that the post office had ever gone out and condemned something to try to destroy it. And it was just one of many such activities. The misstatement is sometimes made that Laetrile contains cyanide, but it's not exactly correct. Cyanide can be liberated from Laetrile by enzymatic action. It's like saying that salt contains chloride. I mean, chlorine gas will kill you, but we eat salt every day. It won't kill you from the chlorine because the chlorine is tightly bound in the sodium chloride by chemical bonds. And it's analogous to the Laetrile situation. That cyanide is bound into the amygdalin molecule. So it has to be liberated by enzymatic action in order for it to kill anybody. But this brings up the JAMA study where some clever person made a slurry of the apricot kernels, which have been known since ancient Egyptian times to be potentially fatal, and then anesthetized the dogs, strapped them down, put a tube in their stomach, inserted slurried apricot kernels into the stomach, and lo and behold, the animals died. Those poor dogs didn't even have a chance to regurgitate this poison that was being inserted into their stomachs. They were sacrificed for the public relations needs of the medical establishment. And not only is it sad on a humane level, but it was pseudoscience, all done in the name of orthodoxy to oppose pseudoscience. Krebs, father and son, and a couple of colleagues of theirs in the 40s originally proposed the name Laetrile to indicate that this synthetic chemical was similar to a chemical found in the apricot kernel, but that it rotated light in a leftward manner. So let's see, probably like this. Well, anyway, normally speaking, this molecule would rotate light in a right manner and in a left manner. It's a categorization that was brought into science by Pasteur, and it's quite a common, common to students of chemistry, whether something turns light on the left-handed way or a right-handed way. So Krebs, the Krebses, and the name Krebs means cancer, by the way, oddly enough, crab or in German, or cancer. Krebs proposed that for various arcane reasons we needn't go into, that a form of this molecule that turns light in the left-handed manner would correspond to the proteins in a cancer and would kill those proteins in the cancer. So he named this levorotatory, meaning left-turning, mandolonitrile, meaning a nitrile that comes from an apricot or a bitter almond, shortened to Laetrile. That's Laetrile, classical Laetrile. Whether they ever actually made Laetrile is another story. There's debates about this. But in any case, when it became popular and when it entered into public commerce, what was being sold was nothing special, Laetrile. It was amygdalin. In other words, it was the common chemical that had been derived since the 1830s from apricot kernels or from bitter almonds. That's amygdalin. It's just a common extract of an apricot kernel that breaks down into cyanide and benzaldehyde and glucose in the presence of certain enzymes.
They are administering Laetrile at the California clinic, not as a drug, but as a vitamin B17. And Laetrile proponents say it is a deficiency of B17 that causes cancer. But most doctors and nutritionists say there's no such vitamin as B17.
And then B17 was a name that Krebs came up with to be synonymous with Laetrile. And of course that's totally illegitimate because he didn't have the power or the ability to name a vitamin. There's actually an international committee that decides these questions of what's a vitamin or not, or else you'd have everybody and their uncle deciding that they got a new vitamin and they would sell this. But you can't, based upon your desires, you can't decide that something is a vitamin. And they've gotten enormous mileage out of that. And even today, patients ask me, what do you think of vitamin B17? Well, there is no such vitamin. It's just another name for amygdalin. Dr. Sugiura was really one of the inspiring people that I've known in my life. And he wasn't a splashy person, to put it mildly. He was extremely mild-mannered. It had a fascinating history. His father was a fencing master in Japan, which was a kind of a low-paying job. And the only reason that Dr. Sugiura got a break in life was he was an outstanding jiu-jitsu performer. He came on the first jiu-jitsu team that ever came to the United States, and they went around the country giving demonstrations of martial arts. And they actually went to the White House, and he performed for Teddy Roosevelt. So you see how far back we're talking here, more than 100 years ago. Through that, he got to know the Harriman family in New York, very wealthy family, and Lyle, who was the physician to the Harriman family. And this all came together that they offered him the chance to stay in the United States as a teenager and go to Townsend Harris High School, the same high school that Jonas Salk went to. And this was a high school for talented kids. And he did that, and he was sort of adopted by the family physician to the Harriman family. And then when the Harrimans set up the cancer laboratory at Columbia, he went to work there, sort of as a bottle washer. I think the year was about 1909 or something like that. As that developed, he went and got an advanced degree at Columbia, and then eventually got a Doctor of Science degree from Kyoto. So he was really in the cancer field from like the time of before World War I. And when you talk to him, you got a perspective on the history of cancer and cancer research that I've never had again from anybody ever that I talked to in the field. I mean, who could have that perspective from the days when they would, to find experimental animals, they would go into the basement of Roosevelt Hospital and catch rats in the basement. That was the beginning of chemotherapy. And I had an interesting argument with a professor at Duke a couple of weeks ago in which he was telling me, that certain treatments were, considered quackery and they didn't want anything to do with that. And I said, well, what about chemotherapy? Oh, no, chemotherapy is very respectable. I said, you know what the beginning of chemotherapy was? It was like quackery. That's how it was regarded. And he didn't know anything about this, But that was the truth. I mean, when Sugiura got into this chemotherapy research, it was very far out. To hear it from the live individual who was there at the very beginning of the field, it's an incomparable experience. And that's what it was like talking to Sugiura. He was a little hard to understand. He still had a very thick Japanese accent, and he was old, of course. But you felt like you were there with one of the foundational figures of the whole field of cancer research. Amazing experience. It showed me that, his integrity and he was simple in the sense that there was truth. He said, I write what I see. Laetrile stops the spread of cancer. It is not a cure for cancer. It is a good palliative drug, meaning in the animal system. Not meaning everybody should run out and get it, but within his world of the animal system. If this had been anything else or something that wasn't controversial, he would have just put his report in and it would have been clear as day. But of course it was Laetrile, and he did what he was told. He saw what the results were and he wrote them up honestly. What more can a scientist do? And he never backed down from it to the day he died. He didn't know about or care about what was going on in Mexico. He was very vaguely aware of anything outside the lab, I would say. It was hard to disbelieve him in any sense because he had no axe to grind. During World War II, he was living up on the Grand Concourse in the Bronx, and Memorial was in the process of transitioning from 104th Street and Central Park West down to 68th Street and York Avenue. So he was threatened with internment as a Japanese person. And Dusty Rhodes, C.P. Rhodes, who was to become the president of Sloan-Kettering in 1945, intervened with the federal government to have him only put under house arrest in the Bronx. So he would go down to 104th Street to the old Memorial, which was in the process of being sort of abandoned and probably not under very much scrutiny. He couldn't go to 68th Street. That would have been far too dangerous. But he was basically breaking the terms of his house arrest and going down to do research because he couldn't stop doing his research. And this was sort of the modus vivendi. I mean, aside from the outrage of this perfectly loyal American citizen being put under house arrest for absolutely no reason whatsoever, but, you know, it was indicative also, I think, of the man that he would risk internment in order to keep doing his research. Research was absolutely paramount with him. So if you wanted to imagine, if you were writing a novel or making a fictional film, and you wanted to imagine a scientist who would be the most credible person to do research on a certain topic, I don't think you could come up fictionally with a finer figure than Kanematsu Sugiura. His reputation was impeccable worldwide, and no one in the past 60 years has ever found anything wrong or incorrect with his previous work. In fact, quite the opposite. Justice Stock famously summarized Sugiura's work by saying that when we get visitors from Russia, they tell us if we see Dr. Sugiura's name on a study, we don't even have to repeat it because we know it's correct to begin with. So he was a totally logical choice to do the Laetrile experiment. The other big reason that he was chosen was that he was retired. So they could be defended from the charge of wasting public money, donated money or taxpayer money on doing Laetrile experiments. That was part of the thinking when they first, in 72, let's say, or at the beginning of 73, when they first gave him the experiments, they were thinking strategically, oh, we're going to get attacked for wasting money on this. We have the perfect excuse. We're using somebody who's on pension. We have to pay him anyway. And so that was part of the reason that he was chosen to be the main experimenter. He had already anticipated all the questions and all the criticism. This wasn't off-the-cuff stuff. This was work performed up to the highest standard of the day. And there was nothing fanatical or biased or emotional or tainted or tinted in his reports. It was all like just as clear-cut and fact-based as you could want something to be. So what more can you ask? And then I saw on the opposite side some of the people who were opposing him with exactly the opposite attitudes. They seemed to be social climbers, people who were, I say social climber meaning trying to improve their own position in life regardless of what the relationship to the truth was, or people running scared, or people who had convinced themselves that their moral obligation under the circumstance was to save the institution. In other words, they put their institutional loyalty ahead of loyalty to the public, which after all is something of an abstraction for most people, or who were just careerists, you know, and didn't want to ruin their careers, and so said nothing, convinced themselves that, you know, their career was more important than this one, telling the truth in this one instance. There's a lot of reasons people can come up with for going along with untruthful statements. But Sugiura never did. They threatened him, according to him, they threatened him with not allowing him to come back to Sloan-Kettering to do the research. That was about the worst thing they could have threatened him with. And he did tell one reporter at least that this had happened to him, and then he died, you know, shortly thereafter. So it was quite tragic, really. I think he died knowing that he had done absolutely the best that he could do. He was chosen years later. When Bristol-Myers Squibb was putting together their history, or sponsoring, I should say, a history of cancer research, they put his picture on the cover of the book as he's teaching young students the techniques of tumors in mice. Yes, it's quite ironic. I think the people who designed the book and put his picture there probably were completely unaware of the fact that it was exactly that technique that was under dispute. This Laetrile thing, I mean, really festered for a long time, and in a way, it still does. And I think, I was a very angry person for a very long time on account of this.
Where are the Sugiura studies in your report? Where are they? Twice you say that the OTA report includes the information presented about specific treatment is all that could be found, rather than a selective culling through a larger body of literature. Really? There's 10 pages on Laetrile. You've got space to put in about the John Birch Society connection. But you have no space to talk about the biggest, most extensive, and probably the best study ever done in a laboratory on any unconventional method. It's gone. It's as covered up today as it was in 1975. So I know what's going on here. And I'm not fooled. And I'll tell you something, that repression breeds resistance. I'm not afraid of you, and I'm not afraid of what you're doing. You continue with this, fine. We'll continue to fight you.
That was a meeting of the Office of Technology Assessment panel evaluating non-conventional cancer treatments. And it was held in Washington, D.C. It was a highly charged, highly emotional time, which in the late 80s, when Brzezinski was really being raided and I would say persecuted, Burton's clinic was being shut down, and then they came out with a report on non-conventional treatments that included a discussion of Laetrile and had not one single mention of the Sugiura studies. Not the first or last time, by the way, that's occurred in supposed reviews of Laetrile. But these were supposedly our friends. So it was partially my anger at the bureaucrats and some of the others who put together this report. That meeting, to which security was called out of fear that we were going to, that the inmates were going to escape from the asylum, as it were, was instrumental in then transitioning to the formation of the Office of Alternative Medicine, which is now the National Center for Complementary and Alternative Medicine, with a budget of $130 million per year. So it was a very important meeting, and I think in the grand scheme of things, my getting so angry at that meeting actually had a productive effect, because it let them know that there were people out there who, didn't forget what had happened, and that we were not going to just stand by idly and allow them to distort the history of this field of complementary medicine without at least putting up a fight. And this then transitioned into OAM, and OAM transitioned into NCAM, and that's where we are at the present moment. I was an unpaid advisor to the Office of Alternative Medicine. Needless to say, I was a controversial choice. The director of the office said that if I were appointed to be on the permanent advisory board, he would resign. And I was appointed to the board, and he resigned. Quite a big disagreement, and I was identified as what they called a Harkinite, meaning that I was a friend and candidate, as it were, of Tom Harkin, Senator Tom Harkin of Iowa. I have no shame in being a friend of Tom Harkin. It's one of my proudest boasts, so that wasn't the problem, but they didn't like, the fact what I represented. If you look at the website, they do all kinds of very nice things. The one thing they don't do, or the reason this office was set up from the point of view of us Harkinites, was to do things like make objective tests of Brzezinski's treatments, like in brain cancer. We thought that was the purpose of the office. But actually, the purpose of the office was to do less controversial things. And the minute things were ID'd as controversial was sort of the end the kiss of death, because controversy Washington doesn't thrive on controversy. I mean, bureaucrats don't thrive on controversy. You don't make waves. You don't do something that's going to seriously anger or annoy any constituency. And so the tendency within government, and I say this based on about 9 years of intense consulting work in Bethesda and in Washington, is not to touch on things that could get people mad at you, just to go do the least controversial things. So they've done a lot of sort of little peripheral things, but the big questions that are on the mind of the public, or at least were on the minds of the public, does this treatment or that actually work? Is it something we should do? These are generally have never been thoroughly explored. And I think, part of the reason I do consulting work for cancer patients, and a big part of the reason that I travel around the world looking at new and unusual cancer treatments, is because the NIH doesn't do that. If the NIH did it, well, I'd have to find something else to do in life. But since they've been so generous as to leave this field open to others, I've sort of stepped in to take part of that burden. And it's a pity that, with the incredible resources, financial and otherwise, that they have, that they don't do some more of this work, because I think it's a big world out there, and no one country, much less one institution, has any monopoly on truth or knowledge. A lot of things have appeared in other countries, other societies of value, and this should be systematically explored. Now we know that in soft tissue sarcoma, if you add heat therapy of a specific kind to chemotherapy of a specific kind, you greatly improve the effectiveness of the chemotherapy. I would say, roughly speaking, with hyperthermia, it doubles the effect of the conventional therapy. That was done in Germany. And then in Holland, you have the experiments done in Rotterdam, adding heat therapy, hyperthermia, to radiation therapy for stages 2 and 3 cervical cancer. So now we have rigorous proof, the proof that always was demanded. Whenever you hear, where are your randomized controlled trials? Easy to say, not so easy to do. But we've got the randomized controlled trials for 2 forms of cancer for hyperthermia. It is unarguable. And I heard at ASCO in 2011, somebody got up and was summarizing the results in sarcoma, in soft tissue sarcoma, and basically my takeaway message was, this is the most effective treatment that there is, a combination of chemo and hyperthermia for soft tissue sarcoma. The main negative, lack of availability of the treatment. That's the negative. In other words, it works, but you can't get it. That, to me, is a totally intolerable situation, plus the fact that our premier institution for testing hyperthermia, Duke, has been defunded by the National Cancer Institute, lost their funding to do the clinical research that we're then told is necessary to do in the United States in order for it to be approved in the United States. You've got to do the research to get even though the research has already been done in Germany, but you've got to do it again in the United States in order to get FDA approval. And by the way, we're cutting all your funding. The funding you would need to do the research to prove that it's effective. I mean, that's madness, absolute madness. So we've got an enormous problem in the United States. The only thing is that, in 35 years, I mean, the world is flat. And now we've got Germany, in Holland, in Russia, in China, in many other countries, people doing treatments basically their own way with less determination by the United States and less determination by big pharma. But the main thing is that the 2 major things that complementary medicine has to contribute to the world of oncology is immune therapy and hyperthermia. Again, they were on the quack list, people may not remember, and now they're orthodox treatments recognized as effective by various medical authorities. So we've got at least the toehold now to, expand the penetration of this into the conventional world. My belief is that we are heading towards an era of integrative oncology. At the moment, integrative oncology is more aspirational than actual, but it does exist in various hospitals, various parts of the world. It's better, the outcomes are better than with conventional oncology. The patients desperately want it. The number of practitioners who can do this and who are helping with this expands every year. The strength of naturopathic medicine increases tremendously every year, as well as the number of graduates. The naturopathic medicine becomes more and more accepted, more legitimate, and there are places in the United States like Oregon and Washington where naturopathic doctors are virtually indistinguishable from medical doctors in terms of their status and what they're legally entitled to do. There's almost no difference anymore. And they can participate now and do with conventional doctors in the management of the cancer patient. So I see a lot of points of light. It's a new world, a new way of treating patients, and I'm absolutely convinced that this is the superior way of treating the cancer patient. I think what we've had to give up on is the idea that either way had the truth, a monopoly on truth. The sort of idea that Laetrile was this one-size-fits-all kind of package of the answer to cancer, as innumerable books have been called, the answer to cancer, as if one person or one theory or one item is going to be the answer to such a complicated disease. This really verges on crackpot science. I mean, that is no, there's almost no evidence for that, and whatever evidence there is very flimsy, and it's not a good avenue to go down. The much more fruitful avenue is to take away from this the message that it's important to look, as Bob Good used to say, we'll test anything. Hey, we had the right idea. And that, we should be willing to use the things that have a preponderance of evidence for them. So hyperthermia, which is a slam dunk when it comes to its additive effects on other treatments. Not a standalone treatment, but an additive, and with excellent scientific credentials and top-notch scientists behind it, should be expanded greatly in the United States. And practically speaking, in other words, the FDA should approve the use of the deep tissue hyperthermia that was used in the European clinical trials and that proved to be so effective. There's no reason to wait for American trials. The Germans and the Dutch are quite as good as the Americans, if not better, at doing clinical research in science. So to say that we're going to wait is to condemn another 20 years worth of patients, because that's what it takes to do a trial like this. It took 20 years from beginning to end to do the sarcoma trial. It's unacceptable, completely unacceptable. And it's also unacceptable to ask American patients to go abroad in order to get treatment in clinics in countries where they don't speak the language, where some of the hospitals are really not set up to treat very sick people. They should be able to get these treatments here and now in the United States. And we're not talking about dubious treatments, certainly not quack treatments, things that have developed sufficiently to make them readily accessible to patients, and also to stimulate the research, because there's still 100 to 1, there are unanswered questions compared to answered questions. But instead of cutting the research into hyperthermia as the NCI did so unconscionably, we should be expanding, because we know that it works. And since we know it works, it should be not just allowed, but, a major focus, because not that many things do work in cancer. And as far as immunology goes, while it's all well and good to come up with drugs like Provenge, which sell for $93,000 for 3 injections, we should be looking at the existing immune treatments that cost next to nothing. BCG, C-parvum, Coley's toxins, TNF, maybe interleukin, interferon, re-examine some of those results, and many other things. We've got the tools to do a more broad-based immunological treatment and, site-specific immunotherapy that's come out of Vancouver, many things around the world that really have plausibility. Now that we've established the principle that immune therapy works, why don't we make it more widely available? And instead, again, it's so restricted and constricted that, you feel the hand of Wall Street in this. I'm sorry to say it, but you can always detect the hand of Wall Street, because why do they go for a $93,000 treatment when there's a $9 treatment available? I'm sorry, but there's only one logical explanation for that. And if you can't research the $9 treatment or the Coley's toxin treatment, and you only can research the Provenge or the Yervoy, then your field is constricted by the economic consideration that you're looking for a treatment that's going to make a whole lot of money for a big corporation, and also for scientists who serve as advisors to those corporations. So in that sense, you'll never get past this basic flaw in the system and this basic fault unless and until there's a political struggle waged to make the effectiveness of a treatment the determinant of whether or not that treatment is made available, rather than the profitability. The more conscious people become of this profit motive and the way it operates in medicine and in cancer in particular, then the more chance there is that people will eventually formulate, political demands that will lead to this reform of the system. If there is greater democratization of the society, then it should take into account the situation in cancer. If people believe that, that there is a kind of this dead hand of Wall Street on the field of cancer research, which many researchers believe, by the way, and many individuals believe. It's not so controversial anymore the way it was 30 or 35 years ago. It's widespread belief. But that has to become formulated into a political program and a political demand. Integration of the conventional with the alternative is the way to go. It's going to be the wave of the future. It has to be, because it's actually more effective in terms of outcome. And there's a study from Keith Block which shows about a double survival time in breast cancer in the patients who receive the integrative medicine. And also there's another study in the works in Vienna showing, again, almost a doubling. So I think they've got their hands on something very powerful there. Are we rolling? Yeah. I think that first of all, the issues that I raised in my book, Cancer Industry, I think have, in a broad sense, have only gotten much more relevant than they were at the time that I wrote the book. When you look at the role of industry and of Wall Street and the profit motive in medicine, this has become much more obvious and devastatingly influential in the development of new cancer treatments. So far from it being, out of date, it grew to a degree that I never could have expected, so that you have one drug, and just take as an example the drug Avastin, which earned last year $6.2 billion for Genentech and its parent company, Roche. $6.2 billion with a B. That's bigger than the whole cancer industry was at the time that I wrote The Cancer Industry. And what that means is that basically you have to have hundreds of millions of dollars at your disposal in order to move a new cancer drug through the pipeline, through the system. And then more importantly, you'd better have a battery of lawyers to defend the patent, because all that a patent is, after all, is a license to defend yourself in court when you sue the person who is infringing the patent. If you can't defend your patent, you might as well not have the patent. So only the biggest corporations can play in this. And we know that nowadays, with the lapse of patents on drugs like Lipitor and some of the other big drugs that are now lapsing, the drug companies are looking more and more to cancer as the solution to their problems in 10, 15, or 20 years. Cancer is becoming one of the main projected profit centers. And the only way that you can envision a cancer drug, to rescuing a company like Pfizer or Bristol Myers or Roche is predicated on the existence of one of these strong patents. Patents don't go to apricot kernels. Patents don't go to vitamin C, not defensible patents that you could, build an entire industry the size of some countries on. Patents only go to unique compounds, and unlike anything else that anybody else has got, or that can't be copied so easily and made into Me Too products that everybody can enjoy the fruits of your labor in getting the drug approved. So we have that, and we have the fact that the cost of developing a new drug is very high. Some people say $700 million. Others dispute that and say that it's quite a bit lower than that. But in any case, it is very much like, if you go to Las Vegas and, off in the corner there is the room for the big rollers. You don't get into that room. They check you at the door and you've got to post a bond of whatever, $50,000 if you want to get into the heavy hitters room. And it's like that. You could propose a food supplement, but you can't make a claim for the food supplement that it cures cancer or helps cancer or does anything. No claims can be made because the claim realm belongs to those who've got the biggest stake and the biggest financial investment. Claims can only be made for pharmaceutical products that have gone through this, let's call it $700 million process. So that process is very much underway. It's what determines the shape of the industry, of the pharmaceutical industry. It's the future hopes of big pharma to rescue their ailing fortunes by making blockbuster drugs in the cancer field. That's the reality behind the whole field of cancer. It's not all drugs, and we know that there are nooks and crannies where different things may go on that aren't exactly just orthodox drugs. But the main attraction at the ASCO meetings and the other big meetings are these blockbuster drugs. You spend $1 billion in order to make back $6 billion a year in the best of times. You expect, a good drug, they expect to make $1 billion a year in sales on that drug. If you don't, you really haven't succeeded. And $6 billion, you'd hit the jackpot. So this is quite a bit inflated from the days when I wrote Cancer Industry, where the amount of monies were very small compared to what we're seeing now. But that's the basic picture of the cancer treatment field. Now, along comes somebody with a bright idea and maybe with a treatment that actually is beneficial. There's a lot of ways of stopping that person. Why would you want to stop them? Because that's unfair competition. If you've got something that's cheap and you can offer it and it's as good as Avastin, why would anybody take the Avastin at $100,000 a year when they could have your substance at maybe $100 a year. It's a difference of 1,000 to 1. Imagine how, if you owned Avastin, how you'd feel about that. You would not be happy to have a competitor who's coming in at 1,000th the cost of your product. So I'm not a conspiracy theorist. The market adequately explains the neglect of the non-conventional treatment and the promotion of the conventional treatment, because I go to ASCO, a meeting, American Society of Clinical Oncology meeting, every year. I've even had a booth there once when I had brought out my book, Questioning Chemotherapy. And I'll tell you what happens. By some magnetism, magic, you have all these little players line the walkways in the hall, and the oncologists, American oncologists especially, make a beeline for the big players, for the big drug companies, for the ones who have the blockbuster drugs, and they look neither to the right nor to the left. I've stood with many people who have smaller companies, smaller products, different things that don't fit into the mainstream. And I've, in addition to my own experience, man, they just go right by you. They don't look. You know who looks? The Chinese, the Indians, the Brazilians. All the people going to stop at your booth are from sort of the outlying areas of the medical field. They have more curiosity. They've come a long way. They want to see everything. The Chinese in particular have the attitude, we want to look at everything. I don't care what it is, where it comes from, show it to us. And they're brilliant in doing this. But the American oncologists in particular are locked into a mindset that's determined by Big Pharma. And that's why they're there, to hear what the latest protocol is ultimately from Big Pharma. And there's a million reasons for that. But that's essentially the way the system works. So the things that don't fit in, nobody's interested in. And, people who feel that they need to come up with conspiracy theories to explain the neglect of complementary medicine, of the less, the more natural products, they don't understand the way the system works. In the case of Laetrile, though, I think Laetrile became a major pain in the butt for the medical establishment, and therefore it was targeted for destruction. The only way I can put it. This targeting wasn't initiated with Sloan-Kettering. So now they're all gone. Lloyd Old, and Bob Good, and Lewis Thomas, they all died of cancer. And Charles Mortel died of cancer, and Pauling died of cancer. So, it's quite ironic. While they were fighting over this treatment, they also were incubating the tumors the conditions that killed them.
What happened to Laetrile since then?
Well, this is very interesting, Matt, because this month, 12 scientists from Germany, from two major scientific universities in Germany, published a paper showing that Laetrile has powerful cancer-killing activity in bladder cancer. 3 separate cell lines of bladder cancer were tested. These were urology departments, and at Goethe University in Frankfurt and in Göttingen University. A university that's had 44 Nobel laureates associated with it, and they showed that there was a dose-response curve in all cases. In other words, the more Laetrile they gave, the more they induced cell death in those cancer cell lines. They repeated each experiment 6 times to be sure that they weren't seeing just a fluke, and also because they understand the controversy. So you add this to the fact that a scientist in Barcelona, Spain, at the Technical University last year showed that even if you removed the cyanide from Laetrile, you had one of the most powerful anti-inflammatory agents ever discovered, maybe the most powerful in the plant kingdom. I think, and there's been studies done in the famous Gila cervical cancer line, the one that was the Henrietta Lacks donated her cells. It kills those cancer cells. It also kills prostate cancer cells. So we've had, even though in the United States there's a dead zone around Laetrile, not one, legal on the books in 21 states, illegal from the point of view of the FDA. So, you will still be arrested if you try to use Laetrile. There's a woman, Maureen Long in Oklahoma, who was arrested or had her clinic raided and shut down last year for using Laetrile in a clinic. The battle goes on. But I mean, from a scientific point of view, even though, as I say, this study and one other study from Mayo Clinic created this dead zone around Laetrile, nobody who cares about their career in the United States apparently is willing to risk the ire of the medical establishment by even examining this. But in Spain, in Germany, in China, and in South Korea, there has been positive work with this. My feeling is, and maybe this was not made too clear in the film, I don't think we need to repeat Dr. Sugiura's results. I think that if you see the film, you read my book, Doctored Results, which is the companion book to the film, I think any reasonable person will come away convinced that his series of experiments were meticulous and they were not refuted by any other study. But we need to take modern science, the techniques and the methods of modern science, and re-examine Laetrile in that context. And that's what's so exciting about this German study, that they know a little bit about the controversy, but they're going to take the methods that are currently used and pursue. They want to do clinical trials. So we have to build, I think, towards funding or helping to fund a clinical trial, maybe in bladder, maybe in prostate, in Germany, at various universities. And I think we can do this with some whatever they call source funding of this. I think this can happen.
Imagine, if this film becomes popular enough and we have a nonprofit that we can work with, and we can literally raise money to help the Germans do clinical testing. How amazing would it be to have a randomized study done on this and once and for all get to the bottom of this darn issue? It may not work, who knows, but it needs to be fairly tested. So I say that because I encourage you guys to try to share this. We have a Facebook page for the film, and tweet about it, do whatever. We want to get people aware of this project, so because it could have a longer life than just the movie.